You know, breast cancer is one of those things that you think could never happen to you. But it can. And actually, this year alone, there will be over 200,000 women who will be diagnosed with breast cancer. And here to talk about some of the surgical options that are available is Dr. Allison Laidley from Texas Oncology. Welcome to the show.
Thank you so much. It's a pleasure to be here.
Thank you. You know, we were talking before about that number. 200,000 women will be diagnosed this year. And you
That's
said
right.
many of those women will have to have surgery.
Almost all of them will have to have surgery at some point in their breast cancer journey. And some of those women will have a mastectomy. Hopefully most will conserve the breast with a lumpectomy. But some women have to have a mastectomy, or perhaps they choose a mastectomy.
Okay, let's talk about the difference between the mastectomy and a
It's commonly called a lumpectomy.
Okay,
It's
got it.
really appropriately called a partial mastectomy. It's
Okay.
where the tumor is removed plus additional tissue around that cancer,
Okay.
so that we're sure we're clear and we haven't left any cancer cells behind.
Got it. Okay. So you will have to make a choice between one or the other. Most women will have to make that choice.
Well, when a woman is presented her surgical options by her breast surgeon, we will discuss each surgical approach and give our explanation or a recommendation as to which would be perhaps better for the patient.
Okay. So let's talk about some of the techniques that are used in regard to the surgery, because many women, you know, like Angelina Jolie just came forward and talked about having an elective surgery to go ahead and have both breasts removed. So, you know, when I heard that, I thought, wow, what does that mean for her? Like, what was that surgery like? What are the scars like? You know, what technique did they use? Can you talk about some of the options?
Sure. Well, when a woman is either has decided to have her breast removed as a mastectomy, or maybe she has to have it removed because of the extent of cancer in her breast, we always want to consider doing reconstructive surgery. Now, reconstruction is much more complicated than a woman having a breast augmentation or an elective breast reduction, because we're rebuilding a part of the body that has had to be removed because of either preventing cancer, as in Angelina Jolie's case, or because she has cancer. So it's at least 2 surgeries, sometimes more, where but these reconstructive options are just amazing, the strides that we've made. A mastectomy is really no longer the mutilating operation that it was for our grandmothers.
Right, or for my mother. I remember my mother's surgery and just what it left behind, you know, and it was, I'm still kind of traumatized by the thought and the vision of that. So you're saying now it's no longer that challenging of a surgery?
No, and in fact, starting in the late 90s and now more widely adopted, we can oncologically achieve a very high cure, a very high result of removing all of the breast tissue and saving all of the skin, including the nipple and the areola. And so once the reconstruction is done, no one would know that the breast has been removed.
Are you serious? Wow, it's come that far.
Now, there's still scarring, and there's some loss of sensation, of course, to parts of the skin and the nipple and the areola when we do that nipple-sparing mastectomy technique. But visually, a woman really looks herself.
That's
and
wonderful.
Sometimes women choose that option and have both breasts removed and maybe even enhance their appearance. So we take a situation where no one wants to have a breast cancer diagnosis, but it's no longer a death sentence for the majority of women. And she has so many options that she can get through this and get back to her normal life.
Oh, which is so beautiful and amazing, and good news for women, because, you know, our breasts are such a personal and intimate part of us and a part of our whole self-esteem. And I'm just so happy to hear that it's no longer the way that it used to be, and that there's some more, you know, prettier, beautiful options for women. I actually had someone recently a woman who had breast cancer, who was excited about it because she could enhance, you know, her breast and move forward, because she said they were so bad after having children for so many years.
Well, that's right. With pregnancy and lactation, a lot of the fullness in the breast changes and becomes pointing in a different direction than it was when you were younger.
Like way south.
And there's options for reconstruction. Some involve an implant, and then there's new techniques where a woman's own tissue from her stomach can be harvested and brought up to her chest, and it can be completely her. Wow. So And again, using the new nipple-sparing mastectomy techniques, the results are cosmetically better and better all of the time.
And what is the recovery like from the surgery?
Well, it's major surgery. It will involve a hospitalization, 2 or 3 nights, depending on the type of reconstruction that a woman has. And she goes home with drainage tubes. And again, they stay in for a short period of time. They're a little bit irritating, but the surgery is always more than one surgery.
Wow.
And I have to emphasize that
Right.
it's like a remodeling of a house. You know,
Right.
it takes stages and steps, and sometimes nips and tucks need to be done even after the final surgery is done with the implants are placed.
That's good to know, because sometimes people think, oh, I'll just do that, but they need to know that it could be 2 to 3 more surgeries after the initial
Right, and
one.
Angelina Jolie even said that she had 3 surgeries
Wow.
in order for her to obtain the final cosmetic result.
Perfect. Well, thank you so much. We talked earlier. You need to come back on because there's so many different aspects of this that we need to talk about.
Oh, there's so many things about breast cancer that are somewhat misconceptions that I'd love to talk about and clear it up
Oh,
for
we'd
you.
love to have you back on.
Thank you so much.
Thank you so much. So, again, we'll have you back on to talk about some of those other options in regard to breast cancer and the many beautiful ways that women can move through this process and beyond.